Well, hello. I'm real excited to introduce Theresa Patterson. Theresa is the executive director for Gennesaret Free Clinic. I got it right that time. I've been trying to pronounce it differently. So Gennesaret Free Clinics, and you guys are here in town. I got turned on to you by another great resource that's a member of Life's Copilot, and I'm very excited to hear more about what you guys do. Tell whoever's watching here today, tell them what you guys do, who you are, and what you do.
Great. Thank you so much for having me. And you were super close. It's Gennesaret Free Clinics. And Gennesaret has been around for 3 decades in Indianapolis. Started in 1988 and started out as one doctor volunteering time in a church, just taking care of homeless people who had no access to health care. And the organization has grown and grown. We are still delivering healthcare to the homeless, but also to the medically under or uninsured. Healthcare is a right. Everybody should have access to some sort of healthcare. And Gennesaret takes care of the most vulnerable people that live in our city. So we offer free medical care, and that takes place in some of our partner organizations. So we're in food pantries and churches, community centers. And we've got a dental clinic where you can get free dental care. The only caveat there is you got to live in Marion County, because that is a partnership with the Marion County Public Health Department. So we are very fortunate to have such a strong partnership with that organization. We do two other things, but one of the things that we're really proud of are our health recovery homes. So we've got 3 homes actually on 2 different campuses, and our homes are a safe place for someone to recover after a hospitalization. So if you don't have any place to go but the streets, you can come and stay at Gennesaret, and we will help you recover. Whether you had an illness or surgery or an injury. And we really do try to help our health recovery home residents build back a life so that they don't have to go back onto the streets. We've got 24/7 care. We've got nursing staff, case management. And typically folks come to us out of the hospital, but people have come to us, well, from all kinds of different things. We've plucked some people off the streets. We've taken people out of nursing homes, some referrals from other agencies in the city. So it's just really wonderful, wonderful place for people to recover. And we have one other service line. It is our Women's Health Services program. And the whole goal and point of that program, Jim, is to help drive down the disparate mortality rates for women of color who are diagnosed with breast and cervical cancer. So we're all diagnosed at about the same rate, but women of color die 40% more than women of all races. So the program is designed to help screen women. So we offer mammograms, we offer clinical breast exams, pap and pelvics. No, those are things that you love talking about, but those are very necessary services for women, and we make it accessible. So we take our services to the neighborhoods. Anyone that's diagnosed with anything through any of our programs, we help navigate them through their course of treatment. So we help you get insurance, we help you find a doctor. The goal is to see women successfully complete their treatment. So we do what we need to do to keep women in their treatment. So if you're doing chemo and radiation, you've just had surgery, you can't work, well, guess what? We can help you pay your rent. We've helped women pay their utilities. We've helped buy food. We help get women to and from their doctor's appointments. So whatever we need to do to be able to support a woman through a breast cancer or cervical cancer journey. So 4 service lines, and they all sound separate, but they're quite intertwined. We refer a lot of patients back and forth through our programs. Wonderful asset to the community. People used to know more about us back in the day. There's, when people took all of their news from the newspapers, but people don't get their news from the newspapers as much anymore. I'm sure there's some Indy Star readers here, but social media has really taken over, and we're really excited to be able to have a platform like this one to bring awareness to Gennesaret and what we do and how to get a hold of us. We do have a 1-800 number, but the very best way to get a hold of us is to go to our website. And you can click on make an appointment, and you'll talk to a real life person who will help you set up an appointment. And nothing's worse than clicking on something or calling a 1-800 number, and it just feels like you're out in the ether. And when you call my 1-800 number, you're going to talk to Angela because she answers the phone. And I love to tell people that. I love to tell people that. Sure, it's a 1-800 number. We established it during COVID because we started doing telehealth, free telehealth. That's a component of our medical clinic as well. But Angela will schedule your appointment for you in our well, she doesn't do dental, but she will get you to the dental clinic, and she schedules all the medical appointments. She schedules the telehealth appointments, and she's kind of our connector and our glue. So she knows how to help navigate folks when they call for help. And most often that's really what people are doing. They're calling for help. And our 2021 mantra is no dead ends, break down barriers, and serve as fierce advocates for our clients and our patients. And that's what we do. Very mission driven team. So if you come to us for help, we're going to either give it to you or help you figure out where you can get it.
So where do people find you? How do people traditionally have found you? Is it from referral sources, or what, how do people know to go to you?
Yeah, it's a great question. And some of it is referral, and we try to be where our patients are. So, if you're going to the food pantry to pick up your groceries for the week, we're right there. Or if you're going to, pick up your kids at the community center, we're right there. But I would say most people find us when they look for free healthcare. So we are one of the first clinics that pops up when you Google free care. And most people are kind of desperate when they are looking up free care. They need some sort of medical help, and they don't have any other options or resources, and they come across Gennesaret, which is a wonderful thing. And there are a handful of other free clinics in and around the area, and we do know who they are, and we like to collaborate with them, because if I can't help you, or maybe I'm not open, but maybe Rafa Free Clinic is open, or maybe you live in Carmel and you can go to Trinity Free Clinic. So we think it's really important for us to know who else is in this line of work, and we really appreciate our collaborations and our referral network.
Well, that's a good point. We were talking about Trinity up in Carmel. You said the people for dental had to be in Marion County. Well, if they're in Hamilton County, then Trinity does that as well. So that's nice to know. So
Sure
there are resources. So how does someone qualify to be with you?
You mean how can you become a patient?
Yes.
So, with dental, obviously you have to live in Marion County. And that would be, I would say that would be typical for all of our programs, but we will fudge on that sometimes, right? So, you really just need to come to us. We try to be as no barrier as possible. Our dental program is supposed to be focused on folks that really don't have any other options. So don't come to us if you just don't want to pay your copay, or something like that, because there are people that really, really have nothing, but they need dental care. And that's what that program is focused on. Our medical clinic, it can be a little, the rules don't have to be quite as rigid. And people come to us for all kinds of reasons. But we don't take insurance, and we don't take any copays or any payments like that. So we try to be as low barrier as possible. So if you need care, you just have to call, and we'll set you up with an appointment. And if we can't care for you, like I said, we have an intense referral network, and we never want to just be a dead end for anybody. If I can't provide the service, then we're going to be hunting down somebody else that can, and we're going to make some really strong connection for our patients, and then we're going to follow up. We're working on, Candace and I are working on a framework for effective referral and follow up, and it's really important to us that nobody goes without, and that people don't continue to slip through the cracks. That's a lot of what our patients are, people that slip through the cracks, right? And we want to be there to catch them before they hit rock bottom. And it takes a lot of coordination and dedication. It takes money, it takes dollars. So we have a lot of supporters that make it possible for us to do what we do. Our medical clinics are all volunteer doctors and nurses and pharmacists. So those folks give up their time to make sure that nobody has to go without medical care.
That's awesome. That's really good. So, well, I'm very excited about having you as a member Lex Co-Pilot. I think that's you're a tremendous asset. I'm looking forward to seeing a lot of your blogs coming forth and education to the people here. So when you're not working, who are you? Tell me what your life is like outside of the office.
Yeah, so I'm a dog mom. I have 4 kids, but my kids are grown-ups for the most part. And the very coolest thing is that I have a 2-year-old grandson. So he turns 2 on Wednesday, and he is perfect in my grandmotherly estimation. He lives here in town, so I get to see him quite a bit. So that really is the light and love of our lives is our little grandkid. So we're pretty fortunate.
I definitely get that. I've got just had our second one, so I'm like over the moon. So, but anyway, that's so much fun.
It is.
Well, thank you so much for sharing with us. I look forward to seeing more and more coming. So.
Awesome. Thanks so much for having us. We're thrilled.